What is the minimum BP threshold for diagnosing hypertension in preeclampsia? A. 140/90ths of a millimeter of mercury. B. 130/80ths of a millimeter of mercury. C. 150/100ths of a millimeter of mercury.
Answer.
A. 140/90ths of a millimeter of mercury. NICE guidelines define hypertension in preeclampsia as systolic is greater than or equal to 140 mm of mercury and or diastolic is greater than or equal to 90 mm of mercury. First-line antihypertensive for preeclampsia in the UK. A. Nifedipine. B. Labetalol. C. Methyldopa.
Answer.
B. Labetalol. NICE recommends labetalol as first line. Nifedipine is second line if labetalol contraindicated. Methyldopa is used in pregnancy but not first line for acute management. When is magnesium sulfate indicated in preeclampsia? A. For all cases. B. Only during seizures. C. Presence of severe features.
Answer.
C. Presence of severe features. NICE advises magnesium sulfate for seizure prophylaxis in severe preeclampsia like in BP is greater than or equal to 160/110ths and those with neurological symptoms. Not all cases require it.
If you're enjoying this video, subscribe to PLAB Diaries. Are you ready for the next question?
Contraindication for methyldopa use in preeclampsia. A. Acute liver disease. B. Asthma. C. Diabetes.
Answer.
A. Acute liver disease. Oxford Handbook states methyldopa is contraindicated in acute liver disease. Beta blockers such as labetalol are avoided in asthma. Postpartum preeclampsia can occur up to A. 6 weeks after delivery. B. 24 hours after delivery. C. 12 weeks after delivery.
Answer.
A. 6 weeks after delivery. NICE highlights that preeclampsia can develop up to 6 weeks postpartum. Monitoring BP and symptoms during this period is critical. Low-dose aspirin for preeclampsia prevention should be started by A. 8 weeks gestation. B. 12 weeks gestation. C. 20 weeks gestation.
Answer.
B. 12 weeks gestation. NICE advises initiating 75 to 150 mg aspirin daily from 12 weeks in high-risk women such as previous preeclampsia. Starting after 12 weeks reduces effectiveness.
Get ready. It's going to get harder now.
A patient with preeclampsia has a BP of 165/110ths of a millimeter of mercury and new epigastric pain. What is the immediate next step in management?
Answer.
Administer IV labetalol and magnesium sulfate. Severe hypertension categorized as having blood pressure of is greater than or equal to 160/110ths requires urgent IV antihypertensive, particularly labetalol. Epigastric pain suggests severe features, so magnesium sulfate is indicated for seizure prophylaxis. Immediate delivery is likely needed after stabilization. Give 3 non-hypertensive clinical features that indicate severe preeclampsia.
Answer.
Headache, visual disturbances, clonus, or severe epigastric pain. Severe features include neurological symptoms such as headache and visual changes, clonus, severe epigastric pain, or organ dysfunction. These require magnesium sulfate and urgent delivery planning. What 2 laboratory parameters must be monitored daily in a hospitalized preeclampsia patient?
Answer.
Platelets and serum creatinine. Thrombocytopenia and renal dysfunction are key markers of worsening disease. Daily labs, namely platelets, creatinine, and liver function tests guide decisions for delivery or escalation. Why is methyldopa avoided postpartum in pre-eclampsia management?
Answer.
Risk of postpartum depression. According to Oxford Handbook, methyldopa is safe antenatally but linked to depression postpartum. Switch to alternatives like labetalol or nifedipine after delivery.
What if you could make eye-catching animations faster than ever, even with zero experience? Introducing Create Studio, you're an all-in-one video editor solution. With Create Studio, you can effortlessly craft amazing animated videos in just minutes. Explore its extensive library of effects, templates, AI voiceovers, and creative captions to truly bring your stories to life. Join thousands of satisfied users. What are you waiting for? Try Create Studio now and unleash your creativity like never before. Click the link below to learn more.